Michigan Medicaid work requirements failed. Lessons learned. Warning: forcing people to work for healthcare can have devastating consequences. Just ask Michigan. Imagine being told you must work to keep your healthcare, even if you're struggling to make ends meet or dealing with health issues that make employment a significant challenge. This is the harsh reality many faced in Michigan when work requirements were introduced for Medicaid recipients. But here's where it gets controversial. Did this policy genuinely encourage self-sufficiency, or did it simply strip away a vital safety net from those who needed it most? Let's dive into the story of Michigan's foray into work requirements for Medicaid, a policy championed by Republicans in states that have expanded Medicaid with the aim of motivating able-bodied Americans to find employment. Robert Gordon, the individual at the helm of implementing these requirements in Michigan a few years ago, now vehemently opposes them, cautioning other states about the impending harsh lessons they are likely to encounter regarding the true complexities of such policies. A cautionary tale from Michigan, as reported by Kate Wells of Michigan Public, https://michiganpublic.org people/Kate Wells. Michigan's experiment with work requirements for Medicaid serves as a stark example of how such policies can go awry. The idea behind these requirements seems straightforward. Encourage able-bodied individuals to work, thereby reducing dependency on Medicaid. However, the reality on the ground tells a different story, one of increased bureaucracy, unintended hardships for vulnerable populations, and questionable efficacy in achieving its primary goal. The unseen consequences, administrative nightmare. Implementing and managing work requirement programs can be incredibly cumbersome, diverting resources away from more critical healthcare services. Vulnerable populations at risk. The most susceptible individuals, including those with chronic health conditions or facing employment barriers, are often the ones most adversely affected, finding themselves in a desperate struggle to maintain their healthcare coverage. And this is the part most people miss. While the debate around work requirements for Medicaid is often framed in terms of personal responsibility versus government support, a more nuanced discussion is needed, one that considers the intricate web of challenges faced by those on the receiving end of these policies. Controversy alert. Where do you stand? Do work requirements for Medicaid recipients effectively promote self-sufficiency? Or do they unfairly penalize those already on the margins? Should healthcare be conditional upon employment? Or is this a fundamental right that should be protected regardless of one's job status? We invite you to share your thoughts. Do you agree with Robert Gordon's stance? Or do you believe such policies have merit? Voice your opinion in the comments below. Originally aired August 4th, 2025 on Here Now, as reported by Michigan Public's Kate Wells. The One Big Beautiful Bill strengthens Medicaid for Kentucky's most vulnerable. Here's the hard truth. The One Big Beautiful Bill doesn't weaken Medicaid. It actually makes it stronger. Opinion piece. The One Big Beautiful Bill aims to reduce spending, boost American energy, and reform Medicaid. It includes work requirements for able-bodied Medicaid recipients, with exceptions for specific groups. $50 billion is allocated for a rural health transformation program. The bill won't harm vulnerable populations. Claims that 35 rural hospitals will close are false. It strengthens Medicaid and encourages workforce participation. Earlier this year, President Trump tasked Congress with creating a bill to enact his domestic policy agenda and jumpstart the American economy. This legislation, the One Big Beautiful Bill, was signed into law on July 4, 2025. It achieved its goal of providing tax relief for Kentucky families, securing our border, investing in military readiness, unleashing American energy, and strengthening Medicaid for the most vulnerable Americans. As chairman of the House Committee on Energy and Commerce, I helped find $880 billion in savings from our committee's jurisdiction. The final bill includes over $1 trillion in savings by eliminating reckless Green New Deal regulations, promoting American energy dominance, and eliminating waste, fraud, and abuse within Medicaid. Despite claims from the other side, this bill is not a disaster for Kentucky families. Let's address some false narratives. Allegation: single mothers, children, seniors, and people with disabilities will lose healthcare access. Truth: the bill ensures vulnerable Americans continue receiving support by removing deceased recipients, conducting frequent eligibility checks, preventing multiple state enrollments, and enacting work requirements for able-bodied Americans who choose not to work. It also expands access to home and community-based services for low-income seniors and disabled individuals. Allegation: work requirements are a ruse to force people off Medicaid. Truth: 4.8 million able-bodied adults on Medicaid choose not to work, spending 184 hours monthly watching TV and socializing, 50% more than employed beneficiaries. The bill requires 20 hours per week of employment, job training, school, or community volunteering, with exemptions for those under 19 or over 65, pregnant women, tribal members, caregivers, and parents with dependents under 15. Allegation: over 35 Kentucky hospitals risk closure due to this bill. Truth: the claim that 35 rural hospitals will close is a mischaracterization. The bill creates a $50 billion rural health transformation program to support rural health providers, bolstering funding for vulnerable hospitals. The legislation eliminates restrictive Biden-Harris-era state requirements, encourages workforce reentry, and refocuses Medicaid dollars on the most vulnerable. With Medicaid spending growing unsustainably, the bill preserves the safety net for future generations. The One Big, Beautiful bill strengthens Medicaid for Kentucky's most vulnerable, and I'm proud to have supported its passage. Brett Guthrie, Congressman for Kentucky's 2nd District and Chairman of the House Committee on Energy and Commerce. Medicaid work requirements: navigating red tape bureaucratic hurdles. Navigating new challenges, work requirements, and bureaucratic hurdles for Medicaid recipients. The recent enactment of a significant tax and spending bill by the Republicans has introduced a wave of new bureaucratic challenges for millions of Americans who depend on Medicaid for their health care needs. A key element of this legislation mandates that, for the first time in many states, low-income adults must fulfill work requirements to maintain their health coverage. While some states have attempted to implement similar measures, Georgia stands out as the only state currently operating a system that utilizes work requirements to determine Medicaid eligibility. In this system, recipients are required to report their work activities on a monthly basis. Tanisha Corporal, a social worker based in Atlanta, initially had no objections to the concept of work requirements. However, her perspective changed dramatically when she transitioned from her position at a faith-based nonprofit to launching her own initiative, the Be Well Black Girl Initiative. In her quest for health coverage, she quickly discovered the overwhelming challenges associated with proving compliance with the state's work requirements. I never anticipated facing the obstacles I encountered while trying to get approved, especially since I was familiar with the process. Corporal shared, reflecting on her 2 decades of experience in human services. Despite her extensive background in social work and familiarity with Georgia's social service programs, Corporal found herself grappling with a complex and frustrating paperwork process. Health advocates are already pointing to Georgia's system as a troubling indication that the new law could lead to excessive bureaucratic red tape, wrongful denials, and ultimately, loss of health coverage for many. Starting in 2027, the law will require adults under 65 on Medicaid to document their engagement in at least 80 hours of work, education, or volunteer activities each month. Alternatively, individuals can provide evidence to qualify for exemptions, such as being a full-time caregiver. Most states will need to establish verification systems akin to Georgia's, which can be costly to set up and maintain. Since the launch of its program, Georgia has already spent over $91 million in state and federal funds, with more than $50 million allocated to developing and operating the eligibility reporting system. Currently, the program has just under 7,500 enrollees. For Corporal, the option of going without coverage was simply not feasible. With a diagnosis of prediabetes and a family history of breast cancer, she recognized the importance of regular health screenings. "I need to stay on top of my health, especially with my family history," she emphasized. On paper, Corporal appeared to meet the criteria for Georgia's program, known as Georgia Pathways to Coverage. This initiative provides Medicaid to adults who would not typically qualify for traditional Medicaid in Georgia, as long as they can demonstrate that they are working, studying, training, or volunteering for at least 80 hours a month. Eager to apply, Corporal was already volunteering more than the required hours. Including her work with focused community strategies and other community improvement projects in South Atlanta. She meticulously gathered the necessary documentation to verify her volunteer hours and submitted her application through Georgia's online portal. "To my disbelief, we were denied. It made no sense to me," Corporal recounted, expressing her frustration despite her qualifications and experience. Ultimately, it took her 8 months of persistent effort to prove that both she and her son, a full-time college student, were eligible for Medicaid. She faced numerous challenges with document submissions, including repeated denials and appeals, as her paperwork seemed to vanish into the system. Corporal recalled one denial notice she received, which stated, "Your case was denied because you didn't submit the correct documents, and you didn't meet the qualifying activity requirement." When she attempted to contact the state Medicaid agency for clarification, she often struggled to reach someone who could assist her. "They would claim they called me, but I checked my call log and there were no calls," she said. "And then I would receive a letter stating I missed an appointment, which was scheduled for the same day I received the letter." After sharing her experience at a public hearing, which garnered media attention, Corporal's application for the Pathways to Coverage program was finally approved in March. In response to inquiries about the delays and difficulties Corporal faced, Ellen Brown, a spokesperson for Georgia's Department of Human Services, stated, "Due to state and federal privacy laws, we cannot confirm or deny our involvement with any person related to a benefits case." She also mentioned that Georgia is working on technological improvements to enhance the document submission and processing experience for participants. Now that Corporal has secured coverage, she must continue to recertify her volunteer hours each month using the same problematic reporting system, which adds to her stress. "Even after overcoming the initial hurdles and getting approved, maintaining my coverage has become another source of anxiety," she admitted. She expressed concern for those without her professional background, questioning how they managed to navigate the system at all. "I believe the system needs to be simplified," she stated. Since Georgia implemented its work requirement prior to the new law, it required federal approval through a special waiver. The state is currently seeking an extension of that waiver to continue the Pathways program beyond its current expiration in September 2025. In their application, officials indicated they would reduce the frequency of required hour verifications from monthly to annually. However, Corporal's experience is not unique, and many health advocates worry that similar issues will arise under the new national Medicaid work mandate established by the recent budget law. Laura Colbert, who leads the advocacy group Georgians for a Healthy Future, highlighted the challenges faced by many, stating, "In Georgia, we have seen that people struggle to enroll in the first place. Even those who do manage to enroll often lose their coverage due to paperwork issues or system glitches." In 2018, Arkansas attempted to implement work requirements as well, but faced similar challenges, according to Joan Alker, who heads the Center for Children and Families at Georgetown University. Many of the problems mirrored those in Georgia, such as website accessibility issues and difficulties in reaching support staff, she noted. Supporters of the national Medicaid work mandate argue that it aims to encourage as many capable individuals as possible to work, while also addressing perceived waste and fraud within the system. U.S. House Speaker Mike Johnson articulated this viewpoint during a June appearance, stating, "We're restoring common sense to the programs to preserve them, as Medicaid is meant to be a temporary safety net for those in dire need." However, Alker counters that national work requirements are unlikely to increase employment rates, as over 2/3 of Medicaid recipients aged 19 to 64 are already employed. The remaining individuals typically include students or those who are too ill or disabled to work. Work requirements primarily serve to cut people off from health insurance rather than promote employment, she asserted. The logistical demands of reporting activities assume that recipients have reliable internet access or transportation to visit an agency, resources that many low-income Georgians may lack. Paul Michael, a licensed truck driver and electrician who has been on Medicaid through Pathways for nearly 2 years, echoed these sentiments, sharing his own struggles with the Pathways web portal. "I faced issues regardless of the device I used, whether at home or the library. It's clearly a problem with the website itself," he explained. Michael also recounted a time when a typo in the system led to a delay in his recertification process, causing him to be deemed ineligible until he could resolve the issue with a representative. This article is a collaboration between WABE and NPR.